Hello, everyone. I'm Cheryl Checkers. Thank you so much for joining Katie Santoro and me for supporting the mental health of female adolescents and young adults in the clinical setting, perspectives from a clinician and young woman on the spectrum. In a few minutes, Katie and I will be introducing ourselves. First, I wanted to take the opportunity to thank FAU CARD and PEPSA for allowing Katie and me to be here today to talk about the important topic of supporting females with autism. I also want to let you know that this training has two components. So you will see two links in PEPSA. One is for a structured PowerPoint presentation on how clinicians and mental health professionals can support female clients with autism. The second component, of course, is today's more informal discussion with Katie. I'm so excited Katie is here today. I believe females with autism are the true experts on their experience. So Katie being the expert today, her willingness to share her personal journey, her challenges and successes, as well as her difficulty getting a diagnosis is really crucial for all of us and our understanding of this autistic female phenotype. Katie, thanks so much for being here. As you know, I'm a huge fan of yours and your advocacy work on behalf of females with autism. Why don't you go ahead and introduce yourself?
Hi, like Cheryl said, my name is Katie, and I graduated from the University of Illinois at Urbana-Champaign, and I'm 27 years old. I was diagnosed with autism at 24. I struggled a lot in employment, but today I'm working at Cardinal Health, and I've been there almost 2 years. Bios usually have fun facts like I like Taylor Swift and I like dogs. I do my own dog sitting business. And what else? I like to travel. My goal is all 7 continents by the time I'm 30 years old. So Antarctica is the next one. I just got a super cute sweater dress to wear on the trip in Antarctica. And I'm really excited to see the penguins there. Yeah, and let's see. I also super bios usually have like I won awards and stuff. I won an award when I was in high school called the Miami Herald Silver Knight Award in drama because I was really involved in the theater. The theater, interesting spot for a person with autism. I loved it. And I now work like a part-time job at the Broward Center for the Performing Arts in Fort Lauderdale, Florida. And I don't really know what else bios should have in them, but I think that was pretty good. Let me know if I missed anything. If you want me to put anything else in there. I've gotten better at this, but in job interviews, when they used to ask, like, tell me about yourself, they want things about the job, like where did you graduate and job experience. But I used to just talk about dogs, and that's not really what they want to know in an interview. So
I think you did a fantastic job, Katie. Thank you so much. And how exciting about all your travels. I love that.
Yeah.
So briefly, I'm Cheryl Checkers. I'm a licensed mental health counselor and national board certified counselor in private practice, where I specialize in working with clients with autism and duly diagnosed with a mental health condition. I also have a subspecialty in working with female adolescents and young adults with a late diagnosis of autism. I'm a clinical consultant for FAU CARD, and I lead their ASD and mental health professional task force, where females have been a focus and Katie's joined. So thank you for your work you've done with us on the task force as well. I always like to start off by talking a little bit about language before presentations or, any discussion. There's been such a resurgence of identity first language and the use of the term autistic and, the use of autistic as a form of pride and many individuals embracing autism as part of their identity. Others that, in my experience that I work with, prefer person first language, or person with autism, or person with autism spectrum disorder. I use both terms interchangeably. Katie, can you tell us a little bit about which language you prefer and why?
I like the term autistic because autism is just part of my brain. And I even run my own advocacy Instagram, and in the handle of that, I just use autistic. And yeah, because I'm like proud of who I am. And so yeah, I just prefer the term autistic, like for all the reasons that like you stated.
Thanks, Katie, and I love that. Can you tell us what age you were when you received your diagnosis?
Yeah, I was 24 years old, so that's considered like young adulthood, but also that is it's pretty late in the whole grand scheme of things. Yeah.
Yeah. So what led, tell us a little bit about your journey to the diagnosis, and what finally led to you getting, properly diagnosed.
Yeah, I think that definitely think that, being verbal, that I was like highly verbal. So a lot of people, especially when I was in the ages of like 1 to 5, like that developmental period, that usually like boys might get diagnosed with autism. That was in the late 90s. And we've grown a lot in our understanding of the spectrum. But at the time, just the fact that I was highly verbal, in fact, probably more verbally advanced than most of my peers during that age range. I don't think that helped my case whatsoever. So yeah, and can you repeat the question again? I'm not sure if I answered it.
Yeah, you did answer it. Thank you. And I'll ask you some follow-up questions. So did you suspect you might have autism before you were even told? Many of my female clients will say they've done research online, or they've even taken online assessments. And then when I talk to them about a diagnosis, they're not surprised. Or they might even tell me, hey, I've done this, this assessment. Do you think I could have autism? So I'm wondering for you, since you did get a diagnosis so late, did you suspect that you might be on the spectrum?
I vaguely remember someone suggesting it around the period of when I was like 12 to 14, and I did have a lot of like misdiagnoses ever since like age 5. Like my parents were really struggling ever since I was like in preschool. They had a lot of challenges, and they were struggling like going to doctors and trying to like cope, like what do we do with like our child, and like asking doctors like best practices and like methods to manage. And so, yeah, I think someone suggested it, but it's hard to remember who said that or why they might have said something. But in the end, during that time, we actually kind of dismissed the idea, and people at the time talked me out of like believing that it was possible. So I just maybe, but it kind of, went away, the idea. And then I didn't think about it for years, so.
Can you talk about some of the diagnoses that you either were diagnosed with or were questioned when they, like you mentioned, your parents were struggling so hard to find a way to support you? What were the professionals telling them at the time was the reason for your struggles or your challenges?
Yeah, I think in like preschool, it might have been like ODD, like oppositional defiant disorder, or then like one of the earlier diagnoses, like I was 6 or 7 years old, and to my understanding, bipolar disorder in that age range is like extremely rare. But they had diagnosed me as bipolar from like the 1st grade, and was medicating adult dosages of medication for it to a 6 or 7 year old, which led to a lot of medical issues. and ADD, nonverbal learning disorder, which is actually kind of linked to autism if you read the research,
Yeah.
but totally different things. Let's see, and nonverbal learning disorder, anxiety, BPD, atypical anorexia, and EDNOS. So a lot of things.
Yeah, so you had the laundry list that often happens when females are, and I'm going to quote, seen as really super high functioning. And oftentimes I hear that ODD and, you know, all the things you mentioned, but the oppositional defiant disorder, they just don't want to do what they're supposed to do, and not picking up that it's really hard. And there are other reasons. It's not, you know, that your child is just trying to go against the rules or what they're being asked to do.
Maybe they're struggling, they don't know how, and they also can't tell you that they don't know how. Even I was like highly verbal, even a highly verbal kid might be like, this is really hard, or I'm overwhelmed, but they cannot like convey that. So then it turns into behaviors.
Absolutely, Katie. And you bring up such an important point as well with the medication and being medicated for something you don't actually have. And, you know, the things that can result from being, you know, misdiagnosed and mismedicated, which is, again, sadly, another common thread that you hear with females, especially young adults and adolescents.
Yeah, and I don't take any medications today, and you have to talk to your doctor and see if medication is and if it's an individual person to person type of decision based on the individual person's needs. But for me, since you know, like there's no medication essentially for autism as itself, maybe like things like, you know, related, not really, you can't just really medicate just for autism as a broad scope of it. And so, yeah, for me, I don't take medication and I've never felt better. I'm a happy, healthy, well-adjusted individual. And that was all from self-advocacy skills. So, but yeah, exactly. It was unfortunate that I had to go through all of that, but that's one of the reasons why I'm here advocating today, so that clinicians can watch this and get an understanding of different presentations of autism.
Thank you, Katie, again, for doing this. And you know, a lot of the female clients I work with who are your age, you know, they've even had hospitalizations and other things before they kind of hit rock bottom before they were able to get a diagnosis. And I know a big part of your advocacy is to change that for, you know, females that come after you. So I really appreciate that. And I know, you know, we all appreciate that. And again, as I said at the beginning of the presentation, you're the expert here, and you do your willingness to share with us allows us that lens of how, you know, how this looks so much different than what clinicians are trained in graduate programs. First of all, you know, the extreme male brain, which is, you know, all the research, you know, early research was based on. I'm sure you've probably heard, oh, you don't look like you have autism, or you couldn't have autism,
or you're too pretty to have autism.
Yeah.
That's a good one.
Yeah.
What does looking pretty and autism have to do? Like, it's in my brain, and you really can't even see my brain. So that's very confusing, very perplexing one for me, but very commonly stated.
Absolutely. I'm so glad that came up here, because that is so important. It's like, you know, what does autism look like? Well, you being here today shows us this is what autism looks like. It doesn't look like what many people have in their minds from very early stereotypes. So
or like what they see on TV. Yeah, or like what they see on TV, you know, it's like, you've met one person with autism, you've met one person with autism. Like that's why it's a spectrum. And two people could present very differently, but also in that Venn diagram of things, like share in the middle, like share like commonalities. And that is really like the definition of like the spectrum. So.
Yeah, I thank you for bringing that up too, Katie. And the PowerPoint presentation component of this, I do have a chart like that. And, you know, it's so important that clinicians understand it's not like a straight line, and it's someone that has a little bit of autism or a lot of autism. it really is that, whether, however, you are functioning, the most often individuals that are on the spectrum are going to share some of those traits, if not all of them, just to a different degree. So that is important to our learning, as well as as clinicians, to be aware of that. It's not that linear gradation, it's more of a that kind of like a chart, as you were mentioning. I use a wheel that has like all the different pieces in it. So that absolutely important. So can you tell us, therapists that are listening, to tell their clients if they suspect autism? And I know, you've shared your story with me in the past, and you feel like sometimes therapists might not be comfortable sharing with their client, a young female client, that either adolescent or young adult, that they are, that it's even on the radar. If it is, like, if they are even considering it, oftentimes they kind of withhold that. What can you tell us about that?
Yes, I think therapists should tell their clients if they suspect autism, and the therapist should not fear what the client may think or say. And I know that was the case in my case. The therapist suspected perhaps maybe 2 years prior to even telling me, and that's a big waiting period of plenty of things that could have helped me in the employment world. We tend to think about high school to transition to adult, people that went to college and they're transitioning to adulthood, so that transition could have been easier. And yeah, I think it's best to tell for parents or clinicians to tell just ask them, yeah. Because it really could help them. And you might get a client that says, oh, most certainly not, why would you suggest that? But at least you tried. And maybe they'll come back around, or somebody else will suggest, and they'll remember. You'll be like that first step. Or maybe in my case, when my therapist told me, I was like, thank you, like, you literally saved my life. Like I think about that therapist a lot. So I definitely think that they were way ahead of their time in realizing it, like 2 years prior. But what they were not ahead of their time is knowing that you should tell your client as soon as you make that observation, which I just told all the clinicians here. So
yeah, thank you, Katie. Another important thing for us.
Like my thoughts like focused on that one, but I think they got it.
Yeah, absolutely. And and as you mentioned, not all people will be ready to hear it, and that is the case. I've experienced some of my clients aren't ready, or they want to distance themselves from it, or they even have that male stereotype of the hand flapping and spinning, and they think, what does that mean? What does that mean for me? So I think another important part is helping females listen to people like you. There's a lot of books and websites and YouTube videos and all kinds of things out there by autistic females. I think to normalize this. So if a client is having difficulty, sometimes I don't know if you agree or if that you've done any of that, but sometimes just kind of having them slowly look at some of these things and realize that doesn't mean they're good, like their life goals can't be met or anything else. It just means there's more information now to support, them along their journey.
Yeah, I did do that. I did. I don't do it as much anymore because I kind of went through that like very intense hyper focus looking at every YouTube video that there was about women and autism on YouTube, like Yo Samdy Sam, great one. If you want to write that one down while you're watching this presentation, Yo Samdy Sam, she's super cool female on the spectrum with a great page for our clients to check out if they're struggling, like Cheryl said.
How do you spell that, Katie? Because I'm not even aware of that one. I'm gonna check it out.
Let's see. I think it would be YO space Sam SAMDY space SAM. Yo,
Okay.
like,
Yo, okay.
yo, what's up? Like,
Okay.
yo, Sandy Sam.
Oh, okay,
Sandy
great. Thanks. And probably
Sam.
another
Her name
reason
is
you're
Sam,
not,
I think. So her
oh,
name is
Sam.
Sam.
Okay,
Yeah.
great. Thanks for sharing that. And probably another reason you're not watching so much is because you're actually doing it now. You're you're the one, educating others and advocating for other females. So that's a really great thing. All right. So you must have did you, I know I've talked to you about this, but if you could share a little bit about how it felt, and I know you did kind of talk about this, will answer it partially already, but when you got that diagnosis, was it relief? Was it like, this finally makes sense? I mean, I have a lot of females say to me, okay, this means I'm not difficult. There's a reason for my challenges.
Yeah, I went through like a wind whirl of emotions, it was quite interesting. Glad I'm over that part. But I mean, it was great, but it was also, like I said, a wind whirl, my life was in a tough spot then. So I mean, I was really happy to have the diagnosis. It explained things. I was also I don't know, to surprise or no surprise, like a little bit in this denial, like this back and forth denial because of the stereotypes, kind of what you were saying about your other clients, like, oh, the hand clapping, or like, what does that mean for me? I was like, I'm verbal. Like, one of the top things that people talk about with autism is nonverbal autism, or now it's called non-speaking autism, or they want to call them non-speakers. And literally did not describe me like at all, because even when I was like 3 years old, people would walk up to my mom, like just out in public when I was talking in the airport or whatever, and be like, wow, is that your kid? Like, she speaks like an adult and she's a toddler. So it was like, so yeah, that was where a little bit of the denial came in. But as we know, autism is a spectrum with like a lot of different things, not just verbal skills, like executive functioning and sensory challenges, and it's like this whole wheel. So I kind of got over the denial in a little bit of that sense, and I was sad and relieved, but mostly happy, which is why back to what we talked about earlier, I use the term autistic because I'm just happy to know and happy that 24 is late, but it is still quite young in the grand scheme of things. So I feel quite lucky that it wasn't even later. So
Thank you for that, Katie. And kind of a follow-up to that, since we talked a little bit about how females look differently than males, and you've talked about the nonverbal and versus the verbal. Are there any other ways that you see or that you want to share that females exhibit their autism differently than the typical male model that we're all used to?
Yeah, I think that for women, I think we just a lot of the research has shown that we just have more of a desire to fit in. I think that when I was younger, up until age 5, my kindergarten teachers and things like that were picking up on my social interactions being immature or a little different. But yeah, I think that a lot of times they say that the male thing is that boys love trains or things like that, but girls might love certain celebrities like Taylor Swift. And they might be obsessed with that, but that is seen as oh, so typical. Or I actually babysit a girl with autism, so I feel like she's a good example on this topic, as far as the different presentations between boys on the spectrum and girls. She loves Disney princesses, so her family's going to Disney and she just loves the princesses. But doesn't every kid love princesses? But yeah, so just things that are less commonly seen as different. They just might be more intense, or girls might just want to fit in so bad that they mask all day at school, and then they're really good at keeping all their struggles at home, out of sight of their teachers and their peers. Or maybe boys kind of just show all of those behaviors during the day at school or something.
Thanks, Katie. Since you mentioned masking, and I have planned to ask you some questions about that, I'm going to kind of jump onto that topic now since it came up, and that was a great answer. I love that you mentioned the typical interests, and that it's usually the intensity that you have. So you have to, if you're a clinician, you might delve a little further in questions, because on our autism questionnaires, you know, we might say, what's your area of interest? And you hear Disney princesses and you're like, oh, okay, that's typical. But if you explore a little further, or ask more questions, you might find out that I think you used the word obsession. It can become quite obsessive to the point where
or you're watching YouTube videos about Disney princesses for the past 5 hours. You've watched the same Cinderella video for 5 hours.
yeah.
Where neurotypical girls might, you know, have a Cinderella doll and then they go, I don't know, like mix it up a little bit more.
Yeah, yeah, it's super important to know. And then also masking is another super important area, because it is one of the barriers for girls and women to get a diagnosis, appropriate diagnosis of autism. And so masking, for those clinicians that aren't aware, it's a way to hide autism traits, so you fit in as neurotypical. And this can be very damaging. It can lead to autistic burnout. It can lead to depression, other mental health issues. But as you said earlier, Katie, you're saying, you know, they may have masked all day at school. You know, and what I see a lot in my clients is they do, like it's so hard to do this. We probably don't realize, any of us, if we've not done it, how hard that is. And then, you know, parents will say to me, well, you know, my child is good all day at school, but then they come home and, you know, they're so different. You know, their behavior's off, you know, or they want to isolate. But, you know, sometimes that exhaustion from just trying to mask, whether you're in a job or you're at school all day, and then, you know, of course, you know, it makes sense that that reaction would happen. So I'm wondering if you've ever masked or felt the need to mask, and if so, you know, in what environments?
Well, I guess now would be a good time to tell you that currently my hands are under the table and you don't see them, but I have this awesome fidget toy, right? So like, yeah, and I can like pop it and stuff. And I could do this for the entire 2 hours of while we're talking, but it's under the table. So out of sight, out of mind. Yeah, like that's just one example. And then, you know, different presentations of autism, like I'm highly verbal and I'm, you know, out of sight, out of mind, fidgeting under the desk. And you might be like, oh, well, I tap my pencil or whatever, and that's also fidgeting. But could you keep that up for like 5 hours? Like, I don't know. And that's for you to answer. And the girl that I babysit, who, you know, is verbal, but doesn't often do like entire sentences or such. I know from working with her for 3 years that she has a lot of vocalizations, like as a STEM. And when we make these vocalizations, but at school, she doesn't do them at all. Like, so she'll be like really quiet at school, or just like, yeah, or like on vacation, and then at home it's totally different. So that's just a couple examples, but I think that the fidgeting under my desk is a pretty good one to show you. So yeah.
And that, you know, to me, that is a tool. So oftentimes, you know, when clients, whether or not they're female or male, are on the spectrum and they have that need, if they don't know that they can use a tool like that, then they're more likely to either have a meltdown, and we're going to get into talking about meltdowns later, or you know, the different things will happen, like anxiety levels rise. So, you know, it's always wonderful to see, you know, when someone's making use of a strategy or a tool to help them, you know, but it's still, you know, giving you know, insight or giving, you know, highlighting how difficult that must be. Like when you said, well, can you do this for 5 hours? Or, you know, and some people mask even in different ways, and they're, they're doing so much, and they're weighing like every word they say. Sometimes my clients will say they're so afraid to say anything because they don't know what the reaction will be. So they're always like, they're never just in the moment and enjoying, maybe being at school or work or wherever they are, even in a social event, but they're always weighing everything. So, and how can I hide? Like, I shouldn't react like this. So I need to watch everybody around me so that I know how I'm supposed to react, or how I'm, my peers think I should react and stuff like that. So definitely important to make note of that. It looks different in different people, but again, like we said, and you brought up in the beginning, the common challenges to different degrees and different people. You mentioned stimming, and I think that's another important area, because with females, it can look so much different. It can, oftentimes in my clients, it's hair twirling or hair pulling or skin picking. And so it's not the typical, we wouldn't necessarily think that was a red flag for autism. So again, important to understand how stimming looks different. What is there anything else you wanted to say about that? Because I know you mentioned a little bit about it.
Yeah, like it kind of goes like stimming and masking kind of can go together in that whole sense. Like a stim with a lot of people in the autism community might like rock back and forth, which I could do like very heavily or very subtly. Sometimes I could be sitting right next to you and probably doing it like a little bit, but you may not even pick up on it in like a classroom or something like that. Or sometimes it could be a lot more. But I could also choose very consciously to not do that whatsoever, no matter what, no matter like the desire. It might be slightly or very uncomfortable, but I still can do that. And but it also could look like loving swings on the playground, like in a classroom, or like if you have a class and the kids go out to the playground. If you have this one kid that sits on the swing for like 2 hours, yeah, that's typical, but is it more than like that is typical? Because I know I loved swings growing up, and to this day, like I have a swing in my apartment, and I use that like a lot. And it's very like calming and gives me a lot more than maybe just like a neurotypical person like enjoying a swing on a playground just to enjoy it. It gives me a lot more than that.
Thanks, Katie. So let's talk a little bit about meltdowns now. And, I always feel like this is one of the most important areas to educate both my clients and my families, especially on the difference between a meltdown and a tantrum. Oftentimes, and as difference between a meltdown and a panic attack as well, because most my clients don't come in knowing, what meltdowns are. They usually say, I'm having a panic attack, or, their parents might say, oh, they're always having, temper tantrums. And my clients will say, but I'm not, but, everybody's judging me for that. And I'm not really trying, it's not within my control. So meltdowns are so much different and usually caused by sensory issues. And so this is, important, because as clinicians, we can do a lot. Like we can identify meltdown triggers. We can work on what to do if a client is having a meltdown recovery, things like that. Like I work on toolboxes with my clients on how to manage meltdowns. And I did want to mention, like some of my clients, I have therapists that are clients that have autism. And even, and they're, in these professions, they're very successful. And yeah, they still can get to a point where they melt down, and, they may bang their heads until they physically harm themselves. I mean, that is not something anyone wants to do. So that is definitely not a temper thing. That's a meltdown. And I was wondering if, without getting into too much detail, if you can share a little bit about whether or not you have meltdowns, and if you do, what they're like, and kind of like what they feel like inside, to help us understand better how they differentiate from panic attacks or from temper tantrums.
Yeah, they definitely would be, like something that, you feel like very trapped in, and like it's different from like it's like an involuntary type of response from being overwhelmed or not feeling like, you're trying to communicate a message, and that message you either cannot get it out or it's not getting across. Yeah, and just like, like kind of like people are not hearing you, or maybe someone's asking you to do something and you're struggling or incapable, like it's just like over your head, and you don't know how to explain that. So, that's kind of what might cause it.
Okay, thank you, Katie. Another thing that I like to educate on is when it's not for everyone that's on the spectrum, but oftentimes I hear with my clients is that their brain will lock on to something, like whether it's they're ruminating and about a particular thing and they can't shift away. So even if there's something going on that they've been really looking forward to, and it's like one of their favorite things to do, but if they're locked on to this particular thing, they can't shift themselves away from it. And I know you had shared a little bit about your personal story, being in a fitness class, and
Yeah, I'll talk on that if you want me to.
sure. No, I think it's really important to understand this, what this really means.
Yeah, so yeah, like it can include like crying, and then like I usually feel like I'm not able to communicate what I need, or like a change in routine, like you were just talking about. And like the example would be like, one time I was on my way to like an Orange Theory class, and I'm really super huge on schedules. My whole family would like speak on that I love to like have the day planned and the week planned and the month, and what is going to happen 5 years from now even. And they often tell me I have to stick within a certain time frame, like you could only focus on this month, and all the questions that you ask us can only be about this month. We cannot skip to like 2 years from now, because we don't know. But I want to know, because I love to know what to expect. So like that goes back to like the day I plan my day and I make this thing, and I really might get super stuck on what I had like planned, like when I got up that morning, and any deviation might like super throw me off. So when I was on my way to the Orange Theory class, I had a rather long red light, and I wasn't expecting that red light, and I couldn't have planned it out. So the red light was like super more aggravating than like maybe a typical person would have managed this red light. And once I finally got, and I was already kind of sort of like maybe like worried about being late. And so once I finally got inside the Orange Theory gym, it was 6 minutes past the start of the class. And they do have a 5-minute late policy. So if you're 5 minutes late or over, you cannot enter the class. And I was super thrown off by this policy. And I had it in my brain that the time for the class would be part of my routine and schedule for that day. And they even offered for me to attend like the next class, which would have been 1 hour later, but that time was not on the pre-planned schedule. So I could not like get my brain, okay, like I could just go to the next class, like I'm late, like the 5-minute late policy, like let me just go. No, like I had to get in right there, right then, like I had to go to that class. Changes were not going to happen. So I can get very stuck, like inflexibility, and even like ask the same question on repeat, like asking the front desk people, are you sure I cannot just go into this class like right now? And like say that like many times. And I often get like looks, like really like confused, perplexed looks, like, why are you being annoying? Or like, could you stop? Or I even got somebody ask me before, like, what is the reason for all of this? Like, why do you have to do this? But really, like, it's kind of like I'm stuck in this rigid, like inflexible, like unable to like process the whole rules of like, the neurotypical society world. Sometimes it doesn't make sense to my brain. And thankfully, in the end, my ex-boyfriend was there to help me move on from the situation, because I who knows, it might have taken an extended period of time for my brain to process, accept, and like gain that flexibility. So yeah.
Thank you for
Hopefully
sharing that, Katie. I think that does such a wonderful job, better than anything I've ever heard of really explaining that, how difficult that can be. And one of the things I talked about in the PowerPoint presentation was change anxiety, and how any change, even if it's a good change, can cause anxiety, and preparing for that is so important. And for clinicians to understand that change anxiety too, because as you said, like, it may have been something, other people could have moved on from quicker, and just said, okay, I'll grab the next class. It's not that you're trying to be difficult. It's your brain isn't processing that that's what you need to do. You don't, like, it's just locked on to that, I need to be in that class. So
yeah, it's kind of like a shark's jaws, like grabbing your arm, and you're like, no, let go, and it won't let go, and you're like trapped there. And I think what would really help in this situation is maybe having like I had a support person that was there. Otherwise, I'm not so sure I would have been able to become flexible in that situation. So like having a support person. And this has been an ongoing problem since I was little. Like, I've spoke to my mom before this presentation. I don't remember a lot of my childhood, but she told me in kindergarten, they held me back, not for academic reasons, but because I, socially, they said that I was immature socially, and they were concerned about my ability to interact with the kids in the first grade, that I would be behind, but also that, if I was playing with blocks, and they had like maybe like 5 activities, and all the kids like in the kindergarten class have to move on in 20-minute increments to each activity or something, I would not be able to go from like playing blocks for 20 minutes to like playing kitchen. They'd be like, okay, Katie, time to move on to playing kitchen. And I would just cry. Like, I just couldn't do it. And then eventually they just gave up, and were like, she stays in her spot all day. And so, yeah, it's something that I grew into, not out of. I've learned to cope with it as an adult, and that goes back into the masking piece. So
yeah, thank you for sharing that, Katie. And I think it also goes into the ODD and the misdiagnoses too, because imagine, as a young child, you can't shift. It's not because you're trying to be oppositional. It's because you have autism. Your brain, as you said in the beginning, my brain just works a little bit differently. So, that's really important. And as females get older, if they don't get a diagnosis, they continue to get misdiagnosed with things like borderline personality, and bipolar is another common one, and a lot of different things that that don't fit. But it's based on how those behaviors then look in an adult. So, the not moving on from playing one thing to the next, what would that look like in a female as an adult? And then that becomes, like, clinicians trying to, see where that person fits with diagnostic criteria, because we weren't trained on what females look like. So it's not on our radar. So again, this is helping us all have this on our radar. So we, females don't have to wait until they're in their 20s to get diagnosed. Oh gosh.
yeah.
And for your parents too, that's another thing. Like, families go through so much too, because they know, like, they don't know what sometimes, but they know that there's something there, and they fight and fight and fight, and go from clinician to clinician, and have different psychologicals done and medication, and they just want to help their child, and nobody's picking up on it yet. So it's just, it can be very traumatic for a child. And and another thing, like trauma that someone on the spectrum might experience, that we also have to keep in mind, is that these things happened oftentimes from very early on in a child's life, and now you're seeing them as an adult, and those things, that can be traumatic, and happening over and over again. What is that? What would that look like in my clinical practice with a female? And in exploring that. Another area is, being bullied or teased or just not being included, can cause a lot of trauma. And I know we didn't really prepare to talk about this, but if there is anything you'd want to say on that topic, otherwise we'll just move on. It's up to you.
Yeah, I think I was bullied, but I also like did pretty well. Like it kind of wasn't like a linear thing. It was like it depends on the situation and the circumstance. Like in kindergarten, it was like a very ebb and flow thing, kind of like a roller coaster for me is how I would describe that. Like, how in kindergarten, my teachers were like, we don't know how she's going to interact with like the kids in the first grade. Like we should hold her here so she can learn, like how to transition and like, so her social interactions can become more mature, whatever that means, because I don't know. I'm not a teacher or a doctor. But then towards like the third grade, I kind of managed to like understand the social landscape so I could make friends. And I did like stick between like the same 2 to 4 girls and had friends in elementary school, but it's much easier. And this might be the reverse for some people on the spectrum. Like they might make friends more in high school and struggle like later. Like, I mean, it's different for every person. But in elementary school, I stuck with the same 2 to 4 girls. I even like was going on trips to Disney with them. I don't talk to them today, but I mean, but yeah, so, and then in middle school, like a little bit more bullying, like a little bit more struggles, I started to just, yeah. And then in elementary school, I also thought that a friend was like somebody that I saw in lunch every day. Like I saw them at the same time, in the same place every day. I was trying to conceptualize what does a friend mean in elementary school. I think a little bit later than some of my peers were. I thought the same time and same place every day means that we're friends, but that's not exactly what it means. It means that you would be like hanging out with them after school, or they're like contacting you outside of that same time and same place. So essentially I thought I was friends with the entire school. It's funny to me now. Yeah, so I don't know.
Yeah, and that's very common. That's something in the 20 plus years I've been in the field that I see in both female and male clients that I've worked with. And especially with females, it's so important to note that it's not usually that they don't have friends. And, as you mentioned, you had a couple friends. It's usually you do have a couple friends, but the intensity of the relationship might be different. Or oftentimes my female clients will expect like their one friend to only be friends with them, not with anyone else. And so they put a lot of demand on that relationship. So, and do you ever, anything come to mind with that?
With that, I didn't have like this intensity of like relationship kind of thing. But I think that I desperately wanted to figure out how to do the mature social thing so bad that I may have set the bar like higher. Like I wanted to be friends with everyone. I guess I essentially wanted to be popular and whatever that I had to do. But that's very like also like common with a lot of kids, I feel. Yeah. I just remember that like this girl loved horses. So I covered like my entire bedroom from like ceiling to floor with like pictures of horses, thinking that I could manifest us to be best friends that way. I don't know. So I was like, if my whole room is horses, Leah and I are going to be best friends.
Well, and common interests really are a way to, have like a something common to talk about. Like say you were to join like a horse, take riding lessons or something, and she was there, it would give you a way to communicate. But definitely you highlight how things are looked at differently, and expecting that you could, change your room to draw her in as a best friend. And
I think I had no interest in horses. Well, I loved animals like zebras and cows and like the black and white. I think I liked the pattern of it all. And I had no interest in horses as like specifically prior to that, but when I found out she had horses, I think I had a birthday coming up. So I told my mom we have to have a birthday party, like horse balloons and horse cake and everything, and invite her. So hopefully she'll come or something like that. It was funny. Yeah.
And thanks for sharing that. Did she come?
I don't remember. I think the party was pretty cool though. It was pretty cool. The horse cake was pretty cool. And it was at a ranch where we did like horseback riding. So
Oh,
it
nice.
was fun.
Well, you still love animals today, so maybe that started your passion for.
Yeah, I love dogs. I run my own dog sitting business. So yeah.
Yeah. So, Katie, what can you say helped most, or one of the most helpful things after you were diagnosed, either working with a therapist or even outside therapy?
Yeah, I definitely think that finding like supports like in the community. I think that like what helped me was learning about all the resources my area has to offer, such as Unicorn Children's Foundation, Ellis for Autism, all the university card centers that span the state of Florida, and vocational rehabilitation. Like I had never heard of vocational rehabilitation like prior. And you know, at the time, like autism can affect like social, employment, and like school related difficulties, which I probably had, like as I said like earlier on, some social issues, but as an adult my top concerns were like graduating college, which I did, and then not without struggle, and then also like employment. So like the employment piece, vocational rehabilitation was a really good stepping stone and like place to start to get me on track with that. And I highly recommend recommending vocational rehabilitation to like clients who, you know, like their goals might be like within employment, have goals there.
Yeah, thanks for bringing up that resource. And it is something, if you have a diagnosis while you're still in high school, when you have a transition IEP, vocational rehabilitation is usually brought in to help. But oftentimes with females that are getting a later diagnosis, that's not the case. So for clinicians being aware that vocational rehabilitation is a federal program, it's free supports for individuals that have certain diagnoses, and they're located all over our counties. Definitely a nice resource. It's one that I use quite often, and they can help. They assess for training needs. They can provide job coaching. There's all kinds of things within the vocational realm that they offer. So thanks so much for mentioning that. And the other resources, of course, thanks for mentioning CARD. That was something that helped me very early on as a parent of a daughter who's now a young adult, who's on the spectrum. And now, over the years, I've always stayed in contact with them, but I'm a consultant for them now. So I love them as a resource as well. The other resources you mentioned, and even the CARD resource, did you want to mention what you do for those organizations?
Yeah, I can share that I'm on the board for Ellis for Autism Advisory Board, and I'm on the board for University of Miami Center for Autism and Unicorn Children's Foundation. I'm the president of their junior board. So yeah.
Thanks for sharing that, Katie. It's so impressive. That just blew me away when I first heard that. So I wanted you to share that. And that's like getting advocacy out on such a broad scale. And thank you for doing all that. All wonderful foundations. All right, so back on track. What would you say is your biggest challenge now?
Well, right now, I love my life. Like my job stuff has never been better, like accepted like new position, and I've been with my company like 2 years, like all things like I wasn't sure if I could achieve, but so yeah, I think that more so like now things are great, right? I like can't really speak to challenges now, not not to say that there were not challenges like along the way, like I think I could speak a lot more to like challenges on the journey, you know, like the journey to diagnosis, or, you know, challenges when you hear about your diagnosis and you're like, oh my gosh, like how do you feel about that? That has a lot of challenges. Yeah, and yeah, just challenges, you know, even once you've disclosed your diagnosis, like what people say back to you know, like you're too pretty to have autism or things like that. So yeah, I think I can speak more on challenges, like we have discussed some of those topics, you know, challenges along the way. But I'm not the best at answering about today's challenges. Maybe that's because life is going pretty good, but that's not a bad thing, right? Like,
No, absolutely not, Katie. And it sounds like getting the diagnosis really changed your life.
I guess that's it. So, you know,
And
yeah.
that's amazing. And I'm, you know, you're doing such amazing things, and it's, you know, not answering that question or not having a biggest challenge now is a wonderful thing. Absolutely. Well, before we finish up, and I wanted to thank you again for being so open about your journey. What is there one last bit of advice you can leave for us mental health providers with regard to females with autism before we finish up?
I don't know if this is okay to say, but like, you know, I think that just like, you know, there was a bit like females with autism, you can have autism and be verbal, like, you know, or, you know, you can be very successful and still, you know, like have challenges, but maybe, you know, like you know, out of sight, out of mind, like you hide them, you know, back to that. So, yeah, just like females with autism can be verbal. Don't forget that autism is a spectrum. If you've met one person with autism, you've met one person with autism. Yeah, every presentation is different, and educate yourself the best you can. And just when diagnosing, just try to, you know, ask your client, you know, and go on that relationship with them, ask them, and make your best educated decision on that. Yeah, so. And yeah, I think all the clinicians here have the power to make a difference. So
Thank you so much, Katie, and you certainly make a difference. Thank you everyone for joining us today. We really appreciate it. And again, Katie, thank you so much for sharing your journey. Bye-bye.